The training will be in English. I'm not sure if everybody knows Swedish, but we know that the ones who's going to look at this need to have it in English at least. Okay, my name is Michael Rosenlind, and I'm the CEO of Alteri Care. Me and Mustafa have spent the last couple of months building the MediX platform that you all have access to, I think. I recognize many of your names from the list. Today we're going to have a training in how to use the platform, and if you have any questions during the presentation, don't hesitate, just ask them. It's better to do it then than ask it later, because it's sometimes hard to explain something that happened 10-15 minutes ago. So let me just start with a presentation. I will share my screen. This is where we are. Is there anything you want to say before I start, Mustafa?
Go ahead. Thank you.
Okay. So the MediX7 training, what we will look at today during this session is we're going through a little bit about the MediX platform itself. We're going to look at how you make yourself available to patients. A quick view on the patient's side of it as well, so you know how they get access to you. And then we're going to look at the actual meeting and the documentation of how you document it in the system with medical records if you're in Sweden and Europe, but if you're stationed outside the European Union, there's some other regulations. So let's start with in PowerPoint to give you a tour of it. So the MediX7 platform is built on the Alteri Care platform, and that is a platform that we provide to healthcare providers basically all over the world. We have customers in Sweden, both regular healthcare providers, but also municipalities. We are working together with NHS in the UK. We have customers in Portugal, where they have a little bit of a different healthcare system, so we're working with insurance companies there. And in Eastern Africa, in countries like Tanzania and Zimbabwe, we are also working with insurance companies on providing basic healthcare online to their populations. So there is it's a broad platform. It's built for this as creating a MediX platform, so you can provide healthcare online to patients all over the world. In step 1, we are going to launch MediX7 as a platform for Sweden and the European Union. You can access it from other parts as well, but the main focus is in Sweden and the European Union to start with. In step 2, that will be quite soon as well, we are going to make this available for patients in Iraq mainly and the Middle East. And why I mention Iraq is that there's a company there with a clinic, and what we need to do is to add the payment methods that you need to have in Iraq. That is not done yet. So there will be continued work on the platform, and you will probably notice it along the way as well. So what we are going to do in the month ahead is connect the platform to something in Sweden called NPÖ, National Patient Overview. So you working in Sweden will have access to the patient data that you normally have in your hospital or clinic where you work today. We're going to have links to Unilabs, so you can order tests to patients, and also to the service called Förskrivningskollen. It's a Swedish service to provide prescriptions. So if you have a Swedish doctor license, then you can, from the platform, create your prescriptions. In the future, you will also have the possibility to set your own duration of a meeting. Right now, it's set to 30 minutes. If you think that is too long or too short, depending on what type of service you provide. If you have a primary GP meeting, 30 minutes is probably a little bit too long. But if you're a psychologist, then 30 minutes is a little bit too short. So in the future, you will be able to change that. You already have the possibility to change your own rate, how much you charge for that meeting. So those two together will set up your service, what you charge for it. We are also going to make the registration flow for patients quite a lot easier. We started out with the flow that we have used in Sweden for many years, but we have found out of a way of doing it much easier for the patients. And as I said, we are also going to create a payment method for Iraqi patients, and it will be QR card if that stands over time. So still some things to do in the future. So making yourself available to patients is obviously a key component in this. So you already are registered, I think all of you, on the platform. So that means that you have access to it, and you get that access when you have a contract with MediX. So when the contract is signed, you get registered into the platform with your specialty, what you're working with, and also in what languages you can meet patients. So if you're based in let's say that you're based in Iraq, perhaps you don't feel confident in having patients and speaking Swedish. So that is part of the setup. So we depending on those settings, you get the patients that you feel confident in treating. What you need to do when you come into the platform, and you will see all of this when I show it to you just in a little while, is go into my profile, and some of you have already done that, and write a description and add a profile image. And this description and profile image is also published on the web page. So it's basically the marketing material. It's a good idea of writing it in English and Arabic, so you can target a bigger audience. And yeah, you will see in a short while. You can also adjust your prices depending on if you want to set another price. There is a default price that is set by MediX. But if you want to have another price, let's say that you have a very high rating from different patients, then perhaps you can raise the price and that compensate for that higher rating. You also set your availability on the web page. So you go into the calendar and say, on Monday between 8 and 10, I am available to have patient through the platform. That is immediately published on the web page, and patient can find you. I think it's a good idea to have those slots quite a lot, a few weeks ahead of time, so patients have time to find you and find a time that they are available to meet you as well. All of this information goes to your public doctor page. That right now there's no link to that specifically, but in a short while you will have your own link. You can create like a QR code or whatever you want to do, and you can do marketing on your own. So they go to your specific page and schedule a time with you. So different ways of getting patients, having patients finding you.
Please, Michael, we have some doctors in meeting list. What can I do?
I can let them in. 1 second. No, there's no one here.
I sent a new invitation for all our colleagues. I don't think so. There is a problem with the invitation. Yeah, we wait. We will continue if something. If somebody come, welcome.
Yeah, let's do that. Yeah, from the patient view, then they find your web page in some way. It could be through marketing, it could be through recommendations and so on. But they go to the web page. They select the language. We have this in 3 different languages: Swedish, English, and Arabic. So they select their language and then start searching for the doctor they are looking for. They can also download the MediX7 app, which is available in 3 different languages for iPhone and Android. So if you have someone with their settings in the iPhone on English, they will get the English app, and the same for Swedish and Arabic, of course. And then that is the language setting that they take with them when they're looking for doctors as well. So when they are searching for a doctor, they're looking for a specialty. Let's say it's a pediatric service that they're looking for, then they can find that in the list, and they can find a specialist in that area as well. They can select the language that they want to have the meeting with you in, if they want to have it in Arabic, in Swedish, or in English. That's up to them. So they find a specialist and select an available time. When they have found a time, they do a short registration to the platform, so we know who they are. They do a payment with a credit card, and that triggers invitations. Send out an email with a meeting link, basically, like you got the link to this meeting in Teams. They will get a link and invitation to a meeting with you in the platform. You will have that as well. So in your calendar, not in MediX only, but in your ordinary calendar, you will have a meeting that you can join through a link. You will also have reminders and notifications sent out to the patients and to yourself, for that matter, to remind them so they don't miss the meeting, and of course that will be a problem for them since they have paid for the meeting. When a meeting is done, the patient have the possibility to set a rating on the service that they provided, that you provided. It's not automatically published on the web page. It goes into a list where it can be reviewed, because we don't want to, let's say that you get a 1-star review, but it's not actually you that has caused the problem. Let's say it's the platform or the internet connection, something has done, there's a technical issue, so they give you a 1-star. That is not because you have provided a bad service, it's something else. So then you don't add that rating into your general rating. You will have a rating changing over time, and of course the higher rating, the higher you are listed on the web page, and also the higher rating over time. If you have 5 stars ratings, you can probably raise the prices as well. That's up to you. When it comes to having the meeting with the patient and the documentation, you log in to the web page. I don't recommend using the mobile app. It's not, from your point of view, when you're working with a patient, you need to write something down, perhaps create a medical record. Using the video might be okay, but I strongly recommend logging in on a computer and having that meeting. It gives a better experience for the patients as well. You will have a link to the meeting. I will show you in a few minutes, where you click on the patient. So you go to that patient and you can see the information they have provided, what type of meeting it is, what if they have sent you some messages or information about the meeting, and then you can join it. It is you who control this meeting. So in the same way as I'm letting people into this one, allowing them into the meeting, you have to allow patients into the meeting as well. They can't start the meeting without you. They can be in the lobby waiting for you to start it, but they can't start it themselves. So you have the meeting, and then it's time to create medical records. And this says only Swedish, but it should be in European Union patients. So you can then create a medical record of it. So if this patient is coming back, you have that note in the system as well. That is available for you. You can set diagnosis also. Right now, the diagnosis is only in Swedish, but it's based on the ICD-10 diagnosis that you are probably very familiar with. When you're done with a patient, you close the case, and it's not only good for the system to close cases because they are then archived and stuff like that. It also gives us information about what is the average time that this type of patient take from their booking the meeting till the case is closed. You can schedule a follow-up meeting if you want, and we haven't talked about the pricing of follow-up meetings. Perhaps it's not the same, but you can schedule a follow-up meeting, and that in some cases triggers a new payment from the patient. Okay, so let's have a look at this. Any questions so far? No? Then I will go ahead. On the web page, you have probably visited it as well, MediX7.com. If you click booking, you have different languages, and then you can click booking on all of them. You will see a list of all the doctors in that language that you have selected. So now, let's say I'm a patient. I have selected English as my language. I can see all the doctors that is listed in the platform. And here we have Mustafa as well. So if we look at Mustafa's profile, we can see that he's been a pediatrician for 12 years. And this is his marketing. So when I, as a patient, go through and I can see this information, I think, yeah, Mustafa is the one that I want to meet. So I click on him. I can see, yeah, we're going to build this a little bit different. So you can select if he has different types of conditions that he treats, then we can also show when he's available for a meeting. If your main target is Arabic-speaking patients, I would write this in Arabic here as well, so it will be on both languages. So if when I'm on this page, I can then select different specialties, and you see there's quite a lot of them, and most of them have doctors connected to it, and you will probably recognize where you belong in this list. Some of them have subspecialties as well, so we can see on a list who is what subspecialty we have. And if I select one, let's say I take family medicine, I can see then who is in this list. So the patient have this search mechanism to find the doctor that they're looking for. I don't have any available hours, so otherwise they will be here. So I can click here and select a time that suits me. I enter some information, my email, and perhaps name. A patient can mainly be anonymous if they want to, but the email address or phone number needs to be there. Otherwise, we have no way of communicating when they should go on meetings and send out invitations and stuff like that. And we don't, if you are a Swedish patient, you have your social security number, and you can then log in with your bank ID as normal in Swedish healthcare and other places in Sweden. So moving on to the actual platform then. The platform, it's called app.mediX7.com. And if you go from the web page as a Swedish patient, you will end up on this page and log in with your bank ID as normal. If you are English or Arabic speaking, we take you to this one instead. You can log in with your username and password. And for those of you who don't know that you have a password, use this password recovery link. There's a few steps. Use your email that you have provided to Wissam and Mustafa. Set your own password, and then you can log in. I see that many of you have already done that because you have updated your profile image and your service
I
description.
just added something. We added your email, which sent to us. Just you can go to the password recovery, and you can just write your email. A password will come to you automatic on your email, and you can get access to the system.
Yeah. And if you have any problems, then of course send an email and we will guide you through it. After this training, let's say on Monday, Tuesday, perhaps something, you will get a user guide as well. So if you're not working with this platform all the time, if you don't remember everything that I have said, then you can go in there and you will be able to navigate. How do I set more available hours? How do I find a specific patient? And so on and so on.
Mika, can you see if something waiting to come in the meeting? Thank you.
Yes, of course. No, they're not.
Thank you.
So I will log in as a doctor now, and I click here. You will then be taken to what we called a dashboard. This is what we have, for now at least, decided that we want to show you the most relevant information that you have. It's divided in different areas. In the top one, you have messages. You can see different messages that has been sent by your patients to you. Let's say that they have sent a chat message. They can, the patient also have possibility to take picture with their mobile phone and send them to you. Let's say they have some skin condition and they want to send it to you. In this case, it's allergy, and perhaps they have some rash they want to share with you. They can then upload that information or send you messages or describe their illness. You can click here. That takes you to that chat message, and you can either respond or you can have that information when you meet the patient later on. So that is quite important. This one is obviously updated all the time. So if you have new messages coming in, they will be listed here. You have my appointments. Now I don't have any appointments, but this list will give you in the chronologic order your patients that you're going to have meetings with, that has scheduled a meeting with you. So you can click on it. That takes you to the patient. So you get into the patient overview, you have a look there, and then you can join the meeting or start the meeting. We also have what we call my active cases, and this is the ongoing list of patients that you are working with. They have different statuses. If they're active, they have paid for it. If they're pending, they have not paid for the service yet. So this one, if they don't pay it in time, it will be deleted and the time that they schedule will be available for someone else to book. So here you can see all the patients that you have. In my case, I have 80 different cases. it can be the same patient several times. If they come back and they have a different condition, they can actually start more than one case with you. But if I click one of those, that takes me into the case. So this is a case management system as well. So it takes me to the overview. I will just let them in.
قول له خليه يقول لي دخلت على حساب النقص تعال.
So in the overview, you can see what is the condition. If you provide more than one service, it might be good to know if it's one or the other. You can see the status, and you can also see when this case was created. You can now you work, as I understand it, on your own mostly. But if you have a team of people working with you, you can actually add them to the care team as well. So let's say that you have a nurse that you want to be part of this case. The nurse can then be the one who responds to chat messages instead of you doing it yourself. So you can add more people to this team. You have the overview of different things. So this patient has a long history of being a patient. There is 10 medical records.
Good morning.
Good morning. You also have files, if they have sent files or you have shared files. You can also see different diagnoses, and you can of course see the scheduled meetings that you have. So if you want to join a meeting, you can just click on the video and you go into it. And I will show you that in a few minutes. When you work with patient, sometimes you need to communicate with them, and sometimes they want to communicate with you. Then you have this chat. You can send pictures, you can send text messages, and you can schedule, when you schedule meetings, this is then provided in as a text message as well, so they can with a link so they can join the meeting. So it makes it quite easy for the patient to okay, I have a scheduled meeting, there's a link, I click it in the chat, and then I join the meeting. You can do other stuff with the patient as well. This is not this is functionality that is available not only for MediX, it's been used for many years. So you can schedule a new appointment. Let's say that you for some reason you can't join the meeting yourself. You probably, let's say that you have an emergency at home or whatever. You cancel the meeting, but you still want to meet the patient. Then you can schedule a new appointment. It doesn't trigger any new payment, but you and the patient, you can communicate through the chat, and you can say, okay, tomorrow at 2 o'clock we will have this meeting instead, and then you schedule that meeting with the patient, so you can join it. If you have any specific observations that you want to write down, let's say that they mention that they are allergic to some specific medication or something else, that you can write it down here as well. This is nothing that the patient ever sees. You don't use questionnaires right now, but perhaps in the future you will be available. It will be possible to send a questionnaire like a health declaration or a specific questionnaire regarding a specific condition. So you get information from the patient. The patient will get a pling in their phone. They fill in the questionnaire, and you get notified that the patient has updated it. So you don't have to interview them during a meeting. You can send out questionnaires ahead of time and spend less time asking those questions with the patient. You can upload files. Let's say that you're prescribing a medication to a patient. Perhaps you want to provide them with information about that medication, and you have that uploaded on your computer. Then you can send it to them. It could be other things as well. It could be training programs if it's obesity. It could be diets if they have diabetes. It could be whatever you want that you send to the patient that you want to share. You also have follow-up meetings, as I said. When you schedule a follow-up appointment, this is a second meeting, and that triggers that the patient needs to pay for it. We haven't really figured out the price list for it yet, but it will be available in the future. You can write internal notes, but that is probably the best if you are not in the European Union. Otherwise, you will have the medical record. So you can add a medical record. So let's try that. You select a template. Right now, there is a template in Swedish. There will be one in English as well. You select that. You say what type of meeting you had with the patient. It's on video, 99.9%, I guess. And it was an initial meeting. Then I click Add New Medical Record. And there is, sorry for those of you who don't know Swedish, but there is a number of questions that Mustafa has provided us with information that you should document after you met the patient. So Sweden, this is leg pain, and yeah, you get the picture. You fill this in. When you think that you don't have to fill everything in if you don't want to. I recommend it, but you fill in what you think is appropriate. When you're done, you click sign, and this is a crucial step because now the information is locked into the system. But you can of course see a mistake that you have done, so you can unlock it again. This is then all the changes are then logged as well after log. And as you can see, this medical record is now updated. The old one is there, and who changed it and when. So you have full visibility on who actually changed the medical record. And then you lock it again. In the overview, you will now see that before I had 10 medical records, and now I have 11. So if I open this up, as you see, I have a medical record that is created today. I have been talking to a doctor. I've written one before as well. So there's another time. This was on the other training. You will see if you have access to medical records. Not all of you will have that. If based in the European Union, you will have access to it. Otherwise, you won't have it. You can see if there's a medical record from another visit that is not in this case, it's been in the platform, but it's not in this case, you can then go through them and back in time. If a patient for some reason provide you with a medical record, some kind of export that they have got from another doctor, you can upload it here as well. So you can have that in the system. This is basically a PDF file where you see this. And when you're done with the case, you can close it. You can search for different conditions. Yeah, which one to take? I can just take one in the list here. Now you're adding this condition to the list of conditions that the system is aware about for this patient. And when you close it, you will have a list there is a list of reasons why you close this. This is an old list that we have, but termination according to agreement. This says in the system that you and the patient, you have done everything that you should. What they have got what they paid for, and you as a doctor are happy with the outcome, and you provided the service as you should. You can save it, but the case is still open, and you can save and close this as well. If you close it, the patient can still access it and look at it, but it's in read only, so they can't send you any more messages. They can't continue contacting you through this case. But of course, they need to be able to go back and look at the history, what you have said, and the files that you have shared with them, and so on. Let's save it. Okay, so this is basically what you need to do. Oh, two more things, sorry. In your top right corner, you have the navigation, what is called a burger menu. You click on that, you get the navigation with all the things that you have access to. If you have a patient that is contacting you not through the platform, but through let's say that they call you, or they send you an email, or someone that you know, you can you can create new cases on your own. You fill in some information about the patient and select what condition they have, and then you create the case. The patient then needs to pay for it, and then they are let into the platform. You have the list My Cases, so you can see all the patients that you're working with and the status of them. So you can actually see if someone has scheduled a meeting with you, but not yet paid for it. So you will have full visibility of everything that happens. The doctor I'm logged in as has access to all cases. You won't have this, because that shows all the cases in the whole platform. So it will be a select few people who have access to that, and also statistics where they can see how many cases are coming into the platform and so on. They can also do the rating management and select those ratings that is coming in, which one is okay, and which one is because some other let's say technical problems or whatever. But this one you will have, that is the price list. So in the price list, you will have the list of services that you provide. In my case, I have allmänläkare, which is a family medicine. but I have it in Swedish and I have it in English. I don't have it in Arabic. So I can then set different prices for those. This is the standard price that MediX have set in the background. But if I want to, I can say, yeah, I'm pretty good at this. Let's take 900 instead. Yeah, for some reason I couldn't say it. So this, you can set your own prices, and you will eventually be able to set the duration of your meetings as well. So if you are a psychiatrist, then you probably want to have like 45 minutes to an hour. If you're working with primary care, let's say you want 10 to 15 minutes instead. And of course, you can then change the price accordingly. So you provide value for money. And the last thing, my profile. And this is where you need to go in when you log in for the first time. I urge you to go into my profile, upload a profile picture, select the language that you prefer to have the platform in. The whole platform is available in all 3 languages. And see if I can find my way back if I turn everything over to Arabic. So everything changes. Oh, as you can see, everything turns into Arabic. That is not what people are writing and not services, but you will find in the menu. And now I don't, yeah, I hope this is the correct one. Where do I find language here? So back to English so I can navigate myself. So go to my profile, upload a picture, and write a description, a sales pitch almost. Your experience and for how long you've been working in that area, and if there anything else that you want to provide. Not a huge amount of text, because that will then it will not look good in the list, but like this, 5-6 rows of information is enough. And do it in English and Arabic, if that is the languages that you prefer. Okay. I know it's quite a lot to take in just going through everything, but I hope you got the big picture, at least, of the system. And as I said in the beginning, you will get a user guide. So when you, so not only for your own sake, but also if you have a patient that is asking you questions, because you're the first contact with them, you will be then able to help them just a little bit, at least, how they log in and how they join a meeting. Okay, any questions?
Yes, hi. Could you please take a look on the chat?
Which one?
There's, I think, 3 questions on the chat.
Yeah, on the chat.
I tried to answer my colleagues, but I don't know if I did right. Just take a look and see.
Okay, so I can read them. Is there a speech recognition, speech to text function in the system? No, they're not right now. We are looking at it, but it's not it's not on the to-do list just yet. Menar asks if our main focus would be just diagnostic, no prescription of any medications or writing sick notes, for example. You will have, if you're a Swedish doctor, at least, you will have the possibility to go to what's called the förskrivningskollen, where you can provide prescriptions, digital prescriptions. Not sure how that works in other countries. Do you know, Mustafa?
Yeah, I think I understand by another way. I thought it's for the patient in Europe and in Sweden, we would do focus of everything, diagnose, history, examination, and if possible, I know it's online, but as a usual, any patient we met in the hospital or a primary health center, we will do a full record. Or you mean another things, Manar? What do you mean? I hope I answer.
I'm just trying. I have been working for Dr.SE and CRE, so I'm just trying to figure it out. Is it the same system that you still have to write the whole journal, then you have to send a documentation, for example, TKMLing, and then you have to I don't know, follow up and so on. For the Iraqi patient, I'm totally like, it's unrecognized for me because I haven't been working there. So that's why the question. So if it's like CRE and Dr.SE, then I can understand like where to put our focus. Is it like, would it be just the Swedish patient? That's the background of the question.
If your patient from Sweden or from Europe, yeah, is the same journal record. If the patient outside of the Europe, you don't need to journal record. We should not do a journal record if the patient outside of Europe.
And for the to write medication, it would be the same to Swedish patient, right?
Medication, yeah. What do you mean? Which type of medication?
For nya recept, för exempel, att de vill ha, jag vet inte, Ozempic eller blodtryck medicin, like high blood pressure medication and so on. So we can, or do we have to renew or prescribe this medication? Like, do you have any manual?
For Swedish people, I send a message how we can do that by förskrivningskollen. For the patient in Europe, I will send another link to write a prescription. For the patient outside Europe, I will say we found a formal how we can write this, and the patient will be responsible to bring medicine by own self. Our focus for the patient in Iraq, and when I write everything, any medication, the patient will take it without any problem.
Dr. Mustafa, not all of us are certified. I'm speaking about myself now. I'm not certified to write medication in Iraq as example, because I didn't take my education there. So let's say if I meet a pediatric patient, which I think, I don't know, I need to write inhalation. I'm not sure how it's work, but I think there are some medication that you have. It would be the same as having, förskrivning kod här.
Yes, if you're speaking about legal working for us, the most of them is graduated from Iraq. It's more legally. But I sent a message in the beginning. I said we will work if you're not graduated from Iraq, our role it will be as will give just second opinion and advice to the patient. And we can speak for everyone how is the working, but you can tell the patient from the beginning, I am give you a second opinion. It become easy and it's more legally. Otherwise, we have a clinic in Iraq. The patient we can come to the Iraq to this clinic and go to the doctor there, and will be doctor to doctor consultation and is legally.
Sorry, Mustafa.
Thank
Okay.
Mustafa?
Yes. Can you speak more louder?
Good morning,
Good morning.
دكتور نصير. شلونك حبيبي؟
حبيبي
شلون صحتك؟ ان شاء الله بخير.
الله يسلمك كبدي.
حبيبي سلامي للجميع.
حبيبي الله يخليك الله يكرمك.
I have a question.
Yes, go ahead.
When you prescribe a drug for a patient in Iraq, the doctor in the clinic will write the prescription. So who will be responsible for this prescription?
Yes, of course, it will be the doctor who write it. Do you hear me, Nasir? The local doctor, it's responsible for prescription.
We have a question from Amara as well.
Assalamu alaikum. This is Ammar, pediatric surgeon. Sorry, I joined late. Thank you, Michael and Mustafa, for this presentation. I actually have three questions, one to Michael and to Dr. Mustafa. Michael, is there any chance to refer patient through the platform to other colleague? The question to Dr. Mustafa, is there any chance that if we advise the patient to visit the platform clinic in Baghdad and then have meeting together with the doctor in Baghdad and patient together to decide the management and to discuss many things, because I think this will make the issue more easier. And then is there any WhatsApp group for all colleagues involved in this platform, or there is chance to have communication, direct communication between us through the platform if I have some technical question or something related to the platform? Thank you.
Okay, I will answer the first question first. If you have a patient that you feel is that is not your field, or you want to have someone of your colleagues to join that meeting, you can add that person into that case. So you will then share that case, and you can then leave it if you want, so you can hand it over to someone else. So that's absolutely a possibility.
Thank you.
There is currently no internal communication like a chat, like WhatsApp that you mentioned, WhatsApp. There's no WhatsApp group in the platform for you to communicate between yourselves right now, at least.
I think WhatsApp it's not very secure. We will escape something in the our platform to see the other colleagues' telephone number or have a communication. Yes, of course, we will have a communication with each other. The other things about the clinic in Iraq, my goal is to create security, and the patient will feel okay. If I cannot use this system, I can go to the clinic, and there is a local doctor will help us to make a case sheet and contact the specialist who is work in this field, who can help this patient in the best way. And this clinic is open for other colleagues. If you have a visit there in Iraq, and you can come to the clinic and meet your colleague, but we should manage this in the proper time to fix this with perfect way.
But in this case, if I am online and the local doctor in Baghdad, a patient visit the local doctor, and then we'll be meeting all the three together, how will be the responsibility, the payment of the patient, and is there available 24/7, or how will be the time work for this doctor in Baghdad?
Yeah, we have about 10 hours per day. This clinic will open 2 shifts per day. And the payment, the most of them, it will be online. We will not take money from by hand. Is if in a way and the patient have no credit card, yeah, we can manage by the payment by the cash, but we will try, will not do it because I want our goal system. You will see your payment in your system, how many will come to you exactly, and Mika can explain this way.
Okay, thank you.
Thank you.
I have a question. My name is Dr. Mohammed Kadoum, oncologist. First of all, thank you very much for this presentation. And I think Dr. Ammar has asked a very good question. It's about, I think it's a new platform, so a lot of question coming maybe the next weeks when we started to engage patients and prescribe things. So we need, or maybe I need, to contact someone with this question. If you have just WhatsApp group just for this question, technical questions, not about the security of the patient included. So I don't know. I'm going to for myself too about this question. So I think it's a good idea that we have someone or some group, so we can also share our problems with the technical problems in the platform in the future.
Yes, of course. If you want, of many doctors want to escape WhatsApp group, I will do. Just send a message to Dr. Wissam, and we will make a group on the doctor. If you, if others like to do that, no problem. Another things about technical. You have my phone number and with Dr. Wissam number. Anytime you will contact us, we will we have different time in other countries. We will make sure maybe 24 hours our telephone, someone have open telephone number or open time to receive any questions if there's something error in the system.
Yeah. And you also raise a very important issue there, Mohammed, and that is that if you find something that is not working, or if you have some issues, it is very important that all of you send that you send that to Osam or to Mustafa, and we can then identify that and make it better. Because when we launch the platform, we know that the reality, the way patients are coming to you, and so on, it is very easy to have a thought and create something like this, but the reality perhaps is not always 100% as you thought before, and we need to know about those things that we